teaching and learning in preceptorships require a multifaceted approach, with preceptors employing a variety of teaching styles to address the diverse learning preferences in their students. Demonstrated teaching involves the preceptor performing tasks and explaining the process in real time, which is particularly beneficial for visual learners who grasp concepts better through observation. Facilitative learning encourages active participation and critical thinking, as learners are invited to engage in discussions, ask questions, and reflect on their experiences. Coaching provides personalized guidance and feedback, helping learners set realistic goals and navigate challenges. Collaborative teaching fosters teamwork and mutual learning, making learners feel integrated and valued within the clinical team. Creating an effective learning environment involves several key elements. A supportive atmosphere where learners feel safe to ask questions and make mistakes is crucial for their development. This includes access to the necessary resources such as up-to-date materials, equipment, and information to support both teaching and learning activities. Structured learning experiences with clear objective timelines and goals help keep both preceptors and learners focused and aligned. Regular feedback mechanisms ensure that learners receive constructive input on their progress and areas for improvement. Additionally, fostering a collaborative culture where teamwork and mutual respect are prioritized enhances the overall learning experience. Debriefing is a critical component of the teaching and learning process. Effective debriefing sessions should have clear objectives to provide direction and focus. Open-ended questions encourage learners to reflect deeply on their experiences, promoting critical thinking and self-assessment. Active listening by the preceptor ensures that learners feel heard and valued, which is essential for building trust. Constructive feedback should be specific, balanced, and actionable, highlighting both strengths and areas for improvement. Emotional support is vital, especially in high stress, challenging situations, as it helps learners manage their emotions and maintain confidence. Barriers to effective teaching, learning, and leadership in CRNA SRNA preceptorships can significantly hinder progress. Time constraints often limit the opportunities for in depth teaching and learning, as busy clinical schedules have little room for dedicated educational activities. Resource limitations, such as inadequate access to necessary equipment or materials, can impede the learning process. Communication gaps between preceptors and learners can lead to misunderstandings and frustration, affecting the overall learning experience. Resistance to change, whether from the preceptors or learners, can stifle the adoption of new methods or feedback. High levels of stress and burnout among both preceptors and learners can diminish the quality of teaching and learning. Effective communication is key to facilitating a supportive preceptor-learning relationship. Active listening ensures that the learner's concerns, questions, and feedback are acknowledged and addressed. Empathy helps preceptors understand and respond to the emotional needs of learners, fostering a supportive and trusting relationship. Clear communication of instructions, expectations, and feedback helps avoid confusion and ensures that learners know what is expected of them. Respectful interactions that value the contributions of learners create a positive and inclusive learning environment. Regular check-ins provide opportunities to monitor progress, address issues, and offer ongoing support. The evaluation process in clinical settings plays a vital role in delivering performance feedback and driving improvement. Assessing competence ensures learners meet the required standards and can practice safely and effectively. Identifying strengths and weaknesses helps learners understand their areas of proficiency and those needing improvement, providing a basis for targeted development. Goal setting, facilitated by evaluations, help learners establish realistic and achievable objectives for their growth. Performance feedback serves as a powerful motivator, encouraging learners to strive for excellence. Finally, evaluations contribute to overall quality improvement by ensuring that all team members are performing at their best, thereby enhancing the standard of care provided. Now I'm going to provide you with your evaluation. Okay, setup and preparation. I'll give you a score of 2, needs improvement. You arrive late this morning, which might preclude you from getting ready for the case. You have to give yourself plenty of time in case you need to search for supplies or medications or troubleshoot common equipment problems. Pre-anesthetic patient preparation and assessment, I'll give you a score of 2. You need improvement. You did not perform a thorough pre-anesthetic evaluation. Drawing up answer for a penicillin allergic patient indicates a failure to review the patient's chart and allergies adequately. This oversight demonstrates a lack of attention to important patient information. Cross-sensitivity between cephalosporins and penicillins is a concern due to the structural similarities between these two classes of antibiotics. Both penicillin and cephalosporins belong to the beta-lactam family and share a similar beta-lactam rate, which can lead to allergic reactions in some individuals who are sensitive to one or the other. Plan of anesthesia care. I'll also give you a score of 2. You need improvement. Your plan of care is incomplete and demonstrates a limited understanding of pathophysiology and pharmacology. You fail to recognize the patient's allergy to penicillin. Additionally, administering 25 milligrams of ephedrine instead of the instructed 5 milligrams shows a lack of knowledge in pharmacology. This dose is too high. If you heard 5 mL, you should have communicated with me and clarified the order. You also fail to acknowledge the effects of positioning on the respiratory system. The steep Trendelenburg position shifts the abdominal contents cephalad, which compresses the lungs, decreasing FRC and increasing your peak pressures. A pressure controlled ventilation mode is a better option in this scenario. You fail to insert an oral airway during emergence, which could lead to negative pressure pulmonary edema. Overweight patients can bite the ET tube, causing airway obstruction. Inhalation against a closed glottis decreases intrathoracic pressure and increases your venous return to the right heart, leading to elevated pulmonary blood volume and pressures. Okay. Lastly, you place the patient on pressure support and reverse them without twitches. Okay. Fully paralyzed patients will not generate spontaneous ventilation and unless you mechanically ventilate them, apnea will follow. Okay. Also, generally, at least 2 out of 4 twitches on the train of 4 are required to consider administering reversal agents like neostigmine. If there are fewer than 2 twitches, the blockade may be too deep, and for reversal with neostigmine, an additional time or alternative management such as sugammatus might be needed. Knowledge base. I'll also give you a score 2. You need improvement. You demonstrated insufficient knowledge in key areas. The incorrect dosage of ephedrine, failure to address the high peak pressures and negative pressure pulmonary edema, and inappropriate reversal of a patient with 0 twitches indicated lack of understanding of pharmacology, pathophysiology, and anesthetic management. Application of knowledge base to anesthetic patient care. You get a score of 2, you need improvement. You fail to effectively apply the anesthetic knowledge in patient care. The issues mentioned earlier demonstrate a limited ability to apply didactic knowledge to anesthetic care. Psychomotor skill. You get a score of 2, you need improvement. You show deficiencies in psychomotor skills, particularly in airway management and patient safety. Failure to place an OPA upon emergence and incorrect administration of reversal agents highlights a need for further skill development and understanding of procedural priorities. Maintenance emergence from anesthesia, transfer of care. I'll give you a score of 2, need improvement. You demonstrated poor judgment in planning and executing a smooth, safe emergence from anesthesia. Placing the patient on pressure support with no twitches before reversing with neostigmine and glycopyrrolate shows a lack of understanding in muscle relaxant pharmacology and appropriate timing for reversal. You also fail to acknowledge the need for an LPA. Documentation, I'll give you a score of 3, average. Your documentation was complete and accurate. You documented all procedures and provided a concise report to the packing nurses. Professionalism and teamwork, I'll give you a score of 2. Your lateness, texting during the case, and failure to thoroughly prepare and communicate with me demonstrate a lack of professionalism. Effective teamwork and respect for colleagues and patients' time are crucial in clinical practices. Overall evaluation, you get a score of 2. or your performance is below the expected level for your stage of learning, you need to improve in multiple areas with a focus on punctuality, effective communication, and professional behavior. You need to improve your base knowledge of cross sensitivity among antibiotics, the pharmacology of ephedrine, positioning effects on respiratory mechanics, and negative pressure pulmonary edema, and reversal of paralytics. Okay? Thank you.
Thank you. Thank you.
Mhm.